Good morning, y'all. It
Hey.
is 10:54 a.m., so we're 6 minutes early. We're always early. We're always so organised.
No,
we're always
not
so
really.
together.
No,
I'm
not really.
No, I'm in a moon boot right now because you should see the side of my leg. It's covered in bruises.
Oh, my goodness.
Because even though my bed doesn't move, it's in the same spot every single time. I walk into it every single night. That's what's happening.
I broke my toe last year walking into a chair that also hadn't moved for, I don't know, 2 years.
No, the chair hasn't moved, but
No.
we'll still be walking into it.
The live chat has popped out. Okay, cool.
What? Oh, good, we're starting. Hi, Chris. Yay.
Hey, nice to see you. Hear you. Connect, yes.
So what are we starting with? Are we starting with autistic blank faces?
Yes.
Or are we, blank faces. So
I've got an important meeting this afternoon, and it's with people that I've met with before, and I might be completely misreading it, but I just get concerned that they think I'm not taking certain things seriously enough.
because your face will blank?
Because my face will blank. And, today I'm actually going to be practicing. I'm going to go into the meeting, right, first up, hey, just wanted to let you guys know, because actually informing people, letting them know, getting in rather than sitting there ruminating, which is what I would normally do, what is it that they're thinking? I'm just going to go out with it. But, how do we talk to people about our facial expressions and help them understand?
Because I blank. A lot of the time I'll blank. Even during the live, you'll probably see me sometimes blank. I really try. God, Chris, we love you. I know I say it, but I just want to say it more and more and more and more and more. Love you, and we're so grateful for everything you do.
Absolutely.
Yeah. So if I blank face during the live, it's not because I'm not zoned into you. It's probably because I'm really zoned into you. I'm
That's a
really
really good
listening
point. Yes.
to what you're asking. I'm
Yeah.
writing down your questions, and I'm thinking about how we're going to answer them. So that's what we're talking about.
It's a really good point, because we've got, sometimes we'll have a facial expression that neurotypical people will be going, they're not interested, they're not listening. And it's actually the exact opposite.
Yeah, we're really interested,
Yeah.
but we just can't tell our face, show that we're really interested, like if we're really trying to take it in. So yeah, sometimes it's good if we can give them a warning. And as always, usual rules, any questions you want, drop them in the comments. We will answer them. And let's get to it. Free your mind. Hi, how often do you see people with ADHD and PTSD misdiagnosed with BPD? Oh, Dom.
All the time.
Yeah.
All the time.
I'll let Dr. Dom talk about this one because it's so common.
Yeah, and it's borderline personality disorder. We've talked about it quite a bit because there are so many issues related to the diagnosis, how it's been used in the past for people with complex PTSD. Even now, the understanding of even people who would fully meet the criteria for borderline personality disorder, how much it's related to trauma. But yes, it's a really important one because just the name, personality disorder, immediately is kind of affecting people at that characterological level. Whereas shifting it across, PTSD is a normal response to a very abnormal traumatic experience. ADHD is a neurodevelopmental disorder. And so, yes, we are definitely seeing that a lot and really working to try and make sure we line up people with the right diagnosis.
Because then you can get meaningful support and
Yes.
meaningful help. And hi, Miss Invisible. But yes, absolutely, all the time. Thank you so much for all the support. You guys make this possible. So, free your mind. I was diagnosed and did DBT and no longer meet the criteria but think I'm neurodivergent with PTSD.
Look, this is the other I was literally just about to say that. Thank you very much for bringing it up. Part of the thing with it is DBT is highly effective for neurodivergence. So it's actually, yes, the labelling is really important, particularly if there's stigma associated with it, but luckily the DBT is really effective at both across both as well.
You might want to explain what DBT is.
So DBT is dialectical behavioural therapy. It was developed by a woman called Martha Lynham, and she's very open with her own experience with borderline personality disorder. So she was coming from a lived experience place, and it works. It's works both to really help with skill building. It's not just a talking therapy. It really is a lot more than that. But yes, the other thing is that often once people are feeling more regulated, then it becomes much easier to start to connect with those neurodivergent patterns.
Dr. Dom isn't taking on any other private clients. I'm so sorry. I know we get asked this, but
Thank
no.
you for asking, but not at this
Thank you
point.
for asking, but no, not at this point. But we do a lot of work. We're here every Thursday. You can always come in, pop in. You can DM. Hi, I have ADHD but suspect CPTSD due to prolonged childhood trauma. Would it be worth looking into BPD? We can't give personal medical advice, but Dr. Dom can talk about generally what that looks like.
Yes, so we are increasingly aware at
Miss
the moment
Invisible, I'll write that down.
You know, the particularly more so with autism, but is what I know more about, but that the autonomic nervous system potentially is also neurodivergent, if that makes sense. It's not just the brain. And we are seeing, PTSD being much more common in people with neurodivergence. And we also, very much understand the increased, all the reasons why there's increased risk of trauma for people with a neurodivergent neurotype.
It's something like 20 times more likely to experience trauma if you are neurodivergent as a child.
And also, we did the post, it's those we're much more aware now the micro traumas are a big part. They will also contribute to creating PTSD. If you're thinking that your condition is got a strong kind of basis in childhood trauma, then really there are great trauma-informed therapies out there now. We are so much more understanding in this area. The stigma is so much less. The very first thing we do is work with people to shift across. The person who's got PTSD is not the problem. There is nothing wrong with them. Their system is having a very understandable response to the trauma they experienced, and then from there we work now both with body and with the thinking, which is a much more effective. It's really working from both levels.
Dr. Dawn brought an amygdala with her today.
I'll grab the amygdala. I left it over. How did I leave it over?
Of course this bee is going to grab the amygdala. Hey, Lisa.
Hey. So we have talked a fair bit about managing anxiety, managing any kind of autonomic hyperarousal, and a big part of it is, and Hannah, loves it when I say befriending your nervous system, befriending these parts of us that are also making us very uncomfortable. So I promised her, and I've actually brought it. This is my little boy's amygdala. Not the one he's actually got in his brain, obviously, but this is the one that he takes care of and looks at and tries to befriend, because we offer it makes you smile. It makes you smile at a time where you don't really feel like smiling.
But this is also what causes panic attacks when it's sending it, because I'm just seeing some comments about that. And also I now meet maybe 2 of the criteria for BPD. I also suffer from MDD, major depressive disorder. They always labelled it BPD. Someone was censored. After DBT, I realised just how much of my issues was sensory and not emotional.
Okay. Look, that's probably more important. There's so much debate.
Talk about somatic therapy next.
Yeah, there's so much debate about diagnoses. We change these criteria so they're not even stay the same over time. What you can be really doing, whether it's about your neurotype or about your mental health issues, is actually have a look what's affecting me most.
Lisa, I'll write down derealization.
Okay, I've got a lot of emotional regulation. Okay, I am having real issues in interpersonal relationships. Yeah, I do have a lot of sensory issues, and starting to actually connect with those different domains that are affecting you most.
Yeah. And also, if you go down a rabbit hole of thinking, am I autistic? Am I autistic? Am I autistic? Am I autistic? You might be. You might be.
Okay, somatic therapy.
Yeah.
These are the big areas that we have shifted so much, and it's absolutely awesome. So it used to be, that we really kind of looked at talk therapies as the only options for PTSD and trauma responses. But trauma is stored in the body just as much as it is stored in the mind. It's in both.
That's a really important thing to remember.
For some people, they're actually going to experience it mainly as a mental health issue. Others will actually experience it mainly as a physical experience. And the somatic therapies look at actually working with the body to go back
I'm sorry,
to the
we're
mind
skipping,
side of
guys.
things.
It's probably my Wi-Fi. Hopefully it'll sort itself out. Just keep going, Dom.
Yes. So there's a lot of different somatic therapies out
Okay, good.
out there, but they're becoming more and more effective, and they're really great for people who find that talking therapy just immediately puts them into overwhelm. Approaching it from that somatic practice.
Actually, do you want to explain what somatic therapy is?
It's where we work with somatics, the body. So it's working with the body. I'm not trained in somatic therapy. I've got, a little bit of an idea about it. I know one of the versions, Pat Ogden's work in this area. She was probably, one of the real kind of four lost the word there. But she actually works with moving the body and having a look at where there's differences in movement or where distress comes up in relation to different movements and connects through to that way.
And yeah, please like and share the live. And Chris, God, you're a hero. You're just a hero. I thought it was anger from BPD, but it's entirely sensory. It's almost painful. For a lot of autistic people, sensory disturbance is painful. Yeah.
But also for autistic people, interoception. So this is the capacity to be aware of our internal sensations, and emotions are, we read them as internal sensations. Oh, I've got a pain in my chest, or I've got butterflies in my stomach. And if you're experiencing, one of the things that doesn't get talked about that much is how for some people those sensory experiences can be actually painful. It can also be one of the differences with interoception is sometimes not registering all the little build-ups. And so then when somebody becomes aware of an emotion, it's an intense, goes straight into a very intense, very uncomfortable experience.
But there are some, I find some sensory experiences physically painful. Many people will feel this way. I'm going to say it and it'll probably get a reaction. Nails down a chalkboard.
No.
Sorry, I know. I know.
I actually, for a long time I thought I was overreacting. And then I realised, oh my goodness, it's it's one of those sensory things that really...
I can handle chalk.
Yeah.
But nails, like it physically hurts. So I'm just going to go, we'll do Elizabeth and then we'll do Liz. I have PTSD and anxiety and depression. We've got a lot going on there.
And they very much coexist. And generally, we're wanting to manage all the different sides, but, without actually working with the underlying trauma, it can be very difficult to treat the others.
Can you read Lisa's comment? It has about, I have low empathy levels, but a sense of justice and cognitive empathy, but I feel bad about it. That's interesting. I doubt you have low empathy levels.
No.
I doubt it.
No. Look, if you've got that strong social justice, you are caring. Empathy, what is it? It's feeling other people's feelings.
Yep.
So it's two versions. There's the cognitive, where you're aware of what another person's feeling, which is actually far more important from a social connection perspective. But the other one is feeling it in your body. So if you're sitting next to somebody who's got a particular emotion, you actually start feeling that in your body. If you're not connected to that, then there's a whole heap of reasons why that could occur, often because you've been hyper-empathic at some stage and it's been shut off, or that just your wiring just doesn't do that. And either way, it's not a moral failing. It says nothing about a person's capacity to care. And it's one of of all the stigmas that we want to shift in neurodivergence is the whole one of autistic people have no empathy. It is so untrue.
Yeah, autistic people have, I would say, hyper empathy. Yowie flavored, we did talk about somatic therapy and how beneficial it can be.
Yes.
If cognitive therapy has not been effective.
Yeah.
Hearing whispering is painful for me. Yeah, being in crowds feels like walls are caving in. Headphones.
Yes.
Headphones. Loops, yeah.
Love my loops. So I had to go to Time Zone, which I don't know if it's all around Australia, but it's this incredibly noisy children's arcade full of all these
Sav,
games.
you're up next.
And I have always been dreading it. I went in with loops on Saturday and it was just like, oh my goodness.
It doesn't bother me at all. I'm completely fine with all of that.
And that's the whole, everybody's different with it. Just on sensory experiences and trauma as well. So the thing about trauma is it affects your autonomic nervous system, and it will actually, so if you're in a hyperarousal state, your system is actively increasing its sensory, taking the information it's taking in as well.
For your mind, I have Irish exited so many bars and clubs where my friends just think I've disappeared, because I have, because I was like, my skin is on fire. I cannot. Angie, hi. I will get to you. I just wanted to quickly say, a former psychologist said I lacked empathy. I doubt that very, very much.
And again, that's one of the biggest, particularly within professional, now any of the teaching and discussion related to autism, that's one of the first of the stigmas we really want to move.
So we had Sav back. She's AU ADHD and she wants to know which to treat first. I am AU ADHD as well, and I view them as my two little buddies. Sometimes they conflict and sometimes they don't. We can't give personal medical advice. But what do you say to the double phenotypes?
Yeah, so it is actually a real issue from a medication perspective. So for people who've got pure ADHD...
PMDD, we'll talk about that as well, Closer.
And definitely come back to the sleep one, because we were literally talking about that one before. So ADHD responds very well to the stimulants in general. We don't necessarily get as good response in pure autism or in AU ADHD. So there can be quite a different tolerance of the medication. For some people, they go, absolutely, yes, this has made a huge difference. Other people will be, kind of saying, no, look, it doesn't, or they don't use it as often.
Well, I'm not medicated for ADHD. No. I've been offered it, and for me, I don't need it.
Yeah.
We're going to do sleep, and Angie, we will get to you. And PDD, but we my ASD morning, doesn't sleep.
Neuroparenting, when you're neurodivergent, particularly late diagnosis neurodivergent, and then you are parenting a neurodivergent child, there's just layers upon layers.
It's so hard
there, and part of what we were talking about is we know what doesn't work. We know what didn't work for us. We can see in our kids when it's not working. But right now, we don't actually have the evidence. We are working it out in real time, what works. And, one of the biggest, and if you're talking to a neurodivergent parent, generally we will all have the same thing. Not only are we trying to take on this really hard task of doing it differently and trying to work it out as we go along, but we're generally doing it without sleep, because that is a big part of it. There's a huge amount of stigma out there. I've been getting a lot recently about, your child should be sleeping alone. Oh, why,
My son sleeps in my bed. I need to sleep. He needs to sleep.
Yes. And we know that the sleep is good for their brain. So at what point do you but it's a huge one from the perspective of the effect it has on relationships, and the stigma associated. But sleep is so important for their brains. Absolutely.
And it's hard. It's really, really hard.
Yes.
So just sending you lots of love.
And sending love to every new parent out there. But that was, as Hannah said, we need to actually keep acknowledging. I know I do it myself. It's that kind of like, other people find this easy. I'm finding it hard. I must be doing something wrong. Nope. If you're trying to parent differently, if you're trying to give your neurodivergent child that different experience, it is really, really hard.
So can being on multiple antidepressants cause memory issues?
anytime we've got combinations, so all of these drugs are working on the brain, and some of them can cause memory, issues. And once we've got combinations of medications, we've got more likelihood. Nowadays, I've talked a little bit about this before. We've gone through different stages. So we were using combinations way too much and getting a lot of side effects and issues with that. We shifted across to trying a lot more to have monotherapy, but the brain is just too complex.
Yeah.
So nowadays it is much more about complex therapy, but really, but thinking much more about what each individual drug's doing, how they're interacting, and trying to keep the doses down of each. But anyone who's having memory issues, any side effects related to your medication,
please go talk to your doctor.
Talk to your doctor.
Can we answer Claus's question about PMDD and struggling? So PMDD and ADHD, have a BPD diagnosis, but I was young, a mess. But over time, it's due to my cycle. Unsurprising. We no guests. Sorry, guys.
So yes, we do know now a lot more about the impact of that. There's increased rates of PMDD associated with neurodivergence, that there is difference in attention across the cycle. It's not just the depression and the anxiety, and that the drugs work differently in the brain at different times during the cycle. It's a really new and emerging field.
Can I also say that for PMDD, some physicians are prescribing GLP-1s to treat PMDD.
They're popping up in a few different areas at the moment for the gut. Some of the gut dysfunction side of things as well. So watch that space. It is a big area. We are talking about this a lot. I've actually just yesterday registered for a really big meeting that our college is involved in.
Natasha, I'm writing yours down.
Women's issues and the differences across the board in mental health issues.
So just another reminder that we can't give personalised medical advice, but Dom, do you believe in EMDR therapy? Is it effective?
EMDR therapy has excellent evidence for it now. It's been around a long time. It was thought to be pretty weird. There was a lot of study done on it because people were kind of very sceptical. The evidence is very strong for it.
Natasha Jones, if a man never hit a woman until he was 48, does that mean he will do it again? He is bipolar 1. Now, Dr. Dom can give you her thoughts on this.
Well, I'll just jump. The very first thing is, was he unwell at the time? Was his mental illness active at the time? Because having a diagnosis does not justify.
And for me, it's a hard no. It's a hard no. If a man ever lays a hand on a woman, it's a hard no. It's a hard no for me. I know that it's awful if he has PTSD after the army. I know it is. I don't care. I'm sorry. I don't.
And look, this one's not talked about a lot.
ABA therapies come up as well. We'll do that.
Okay, yes.
But you can go first.
Yeah,
and then
so PTSD, the rate where people are violent related to PTSD, it's very real. It is a very real issue coming from the PTSD. It does not make it okay, and it's up to them to really see how important it is that they go and get the treatments available. There are ways
they need it.
Yeah,
they need it, but
they need that treatment. But people need to be safe while they're getting that treatment.
Just Natasha, if I was your sister or your cousin or your mother or your friend, I have a much harsher view that if a man has ever laid a hand on a woman, get out. Don't let the door smack your ass on the way out. I'm sorry. It's just my personal opinion.
I'm slightly more generous from the perspective of I've been hit by patients.
Dr. Dom is a saint and I am...
Well, no, it's also just that if somebody is floridly psychotic, and I'm not just I'm talking where their brain is so affected by mental illness. I have definitely had people incredibly remorseful after they've behaved in a way while they're floridly psychotic. But it's then, one of the things is they then need to make they're responsible for managing their illness so they do not get into that state.
Natasha's saying she has an AVO. If you have an AVO,
well, that's a whole different
this is a different thing.
That's not just a one-off when somebody's very unwell.
I'm really glad that you've done that.
Yes.
Please take care of yourself. Please stay safe, and you've done the right thing. And I'm so glad you're taking care of yourself. I was diagnosed with PMDD and ADHD recently. Vyvanse worked so well for me. I got my second script. Amazing.
Thank you. And
so
one of the things we're hoping with this community is helping people share their experiences when things have worked well for them when it hasn't.
Thoughts and tips on level 2 autism are nonverbal. Depending on age, varies a lot because developmental stages are going to impact that. Do you want to talk to that, Dom, considering your experiences, I guess?
So I was actually nonverbal till I was 4.5, and I then did fully develop language. That happens for some people, not for
Natasha.
others. And it's it's a lot of there's a lot of kind of debate in this area at the moment, as well as to how to support people using what's the word for the alternative communication devices? There's an acronym.
Oh yeah, my brain's on. I'm sorry,
so
guys.
One of the things about being nonverbal is that often people have got a very good understanding of what's going on around them. They are understanding conversation. It's purely about generating the language. So sometimes they can use alternative communication devices. It's a really big area. We did get ABA before, and
yeah, do you want to talk about ABA because we've had that come up twice?
Yes, so this is one that there is a huge amount of very strong emotion within the autistic community.
So he's 5, the nonverbal.
Oh, okay.
Give him time. Give him time. My son was pretty much nonverbal till about 4.
Yeah.
So give him time. And be gentle with yourself while you're going through it. It's really, really hard.
Yes.
Dom, I'll let you get back to ABA.
Really good speech therapists out there.
I'll let you get back to ABA and I'll write Dragonfly.
So ABA was there's a lot of controversy related to it. In the past, it was a behavioural program where children were the goal was to help autistic children present as neurotypical, and it involved
this is my angry face.
Yes, because at the core of that was there's something wrong with who you are, and we need to train you out of being who you are. That was the core message. So, it was quite punitive. So, there were consequences associated with things like
It was still being done really recently.
And it was being done. And look, it is still around at the moment. Some of the people who talk about it will say it has, addressed a lot of the very concerning issues, but there's also very strong feelings that it shouldn't exist at all.
4.5, my son is nonverbal. Give him time. Give him time. It's autistic kids can suddenly just blossom. Don't put any expectations on himself or yourself. You're being a wonderful mother.
Yes.
Be aware you know your child best, and you're doing incredibly. Mushima
I'll just say on that, because one of the real issues as a neurodivergent parenting a neurodivergent child is all those expectations and, you should be toilet training your child. He should be doing this by this age. Oh, why isn't he doing this? And if you know your kid, and particularly if you've had a few experiences, where they have different developmental windows. If you try to push it when they are not in a developmental window, it's awful for you, it's awful for them, it's not going to work. If you wait for the developmental window, suddenly one of the things I've found is autistic kids will often then do it really quickly.
Yeah.
They'll go from no toilet training to toilet training in a couple of weeks. Once they put their mind to it.
Angie, the first time my son spoke, I think he spoke at 18 months, then regressed. And so that was very difficult to deal with. A lot of autistic parents deal with that. But then the first time that he spoke properly to me, probably about 4.5.
Would have just been magical.
The first time he said, "I love you," I cried, bawled my eyes out.
And he's got such a gorgeous voice. He turns around and sometimes he'll come out with whole sentences now. And
this morning he told me that a frog is an amphibian.
Oh.
And this is a boy that was nonverbal at 4.5. So please keep up the hope.
Yes.
And also please like and share the live if you can, guys. It really, really helps. Can you kick Captain Cook, Chris? Because we're not here to
judge other people's parenting under any circumstances.
It's totally unacceptable to judge other people's parenting. That's not, kick, and I'm not even going to read that out. That's
and Hannah and I talk about this a lot because, you know, we are very respectful for our children's, you know, privacy, and we are in a time at the moment where parents of neurodivergent children, the evidence isn't out there yet. Where do we learn? How do we work out what we're doing? How do we kind of, you know, feel okay with what we're doing, unless Chris
will boot him, Angie. Don't worry about that.
Absolutely. Because right now, unless we're sharing lived experience, you know, we are doing this as a community. We are doing it all together, and we need to be sharing what's worked for us, what might work for you. Right now, we just don't have other resources.
And the fact that Angie's in here and talking about it tells me she's a great mother. So
absolutely.
I don't need to hear any of the nonsense.
And we're trying to create a better world for our kids. I care about everyone's kids, not just my own.
Yeah, we care about all of the children.
I want every autistic kid to have the best that they can.
So I've got Dragon. Knowing something is wrong, but doing it anyway. Like, am I trauma broken or narcissistic? We can't give any personal medical advice. But if you know something is wrong and you do it anyway, are you harming other people?
Sometimes it'll be where you're saying, or often it's where you're saying things that are mean or unhelpful. It is one of the more frustrating experiences of being human. It's very,
Chris has got your back,
real.
Angie.
First step is the fact that you are actually aware.
Hey, Blocks.
So you cannot change the behaviour until you're aware. And generally, it's where we have reactive programs, whether we've learnt it as children or seen it around us, where we have a certain trigger and we react in an unconscious way. So that'll be arguing back or saying something mean and snarky. And until you bring in that mindful awareness of it, it's very, very hard to shift.
I just want to respond to Blockstar Luke really quickly.
Hey.
Dr. Dom and I are both autistic. I'm the double phenotype AU ADHD, and suspect Dom is as well.
Yes.
So, yeah, we're also not mad about it. We're talking about it because we're really happy with with ourselves. Batches of Vyvanse not working. I haven't heard about that.
No, I haven't, but I will now look into that because I've got a couple of pharmacists who are very, very helpful about bringing me up to date about things that are happening along those lines.
No access to meds. I have bipolar and CPTSD. How do I stop having to have weeks in bed? Jasmine, it's rough. We hear you.
Absolutely rough. And, there's, one of the things that can be most frustrating.
Heavenly writing it down.
About neurodivergence, about any of the mental health disorders, is the fluctuations, is the inconsistencies. And, I think we can all remember experiences where we got that energy, got out and started something and then crashed back to bed again. Very, very much working with self-acceptance and bringing in that mindful awareness. So the worst thing can be stuck in bed, ruminating and beating yourself up for being in bed. So if you've got an inner critic, I shouldn't be doing this, you're also not recovering. So very, very first step, if you have, and Hannah and I regularly have conversations that, today's a rest day. Today is...
I can't do anything today, and I won't because I can't.
I've got a lot going on in the outside
ADHD
world
squad.
at the moment. And once you actually start really owning it. So I spent 10 minutes in bed before coming over here today, and I can actually use those 10 minutes now to get a reset. It used to be days or weeks. So it's also that idea of you really immerse into allowing that healing and allowing that
and
reset.
Don't shame it.
And do not, absolutely.
Just go, I need this day.
Yeah.
And I'm taking it.
Yeah.
Question on stimming. I'll allow my son to stim as much as months. How long is too long? For me, I have no limits on stimming.
It depends on the stimming. It depends on
Hey,
is it affecting function? Is it harmful? There's a bit of controversy, where we would love to see a world where kids can stim completely freely, but we don't live in that world yet.
Not yet. Free your mind. I do the same things. I call it cricketing, rubbing my legs together in bed.
Yes, and it's also checking in. So stimming can be lots of different things. You can see stimming where the person's doing it from a really enthusiastic, they are radiating all of those
happy stimming.
Oh, yes, do not, but if you've got stimming where you might do it occasionally and suddenly you're doing it all the time, you're really wanting to also do that bit of detective work. What's going on with my autonomic nervous system at the moment? Why is my body needing to release all this tension at the moment? So using it to actually inform as to what's going on.
We had a question from Heavenly, who said that she has a friend who's ADHD who struggles and can really lash out when she's in a bad place. What are ways to support her when she's in a bad place? The fact that you're asking is the first step. So you're clearly a caring friend who considers what her friend needs.
Yeah.
But please never put yourself in a position where you can be harmed.
Yes.
And then come back when your friend is regulated. And
then help them, the being if you can talk to them in a way that's not shaming.
Getting a diagnosis
but at the
is hard.
same time really helps them understand, sometimes, particularly if someone's lashing out with a lot of anger can really kind of blank your mind a bit. So people afterwards are not necessarily, they'll just say, oh, my head just all went red and I don't remember much after that. So giving them feedback, compassionate feedback.
Yeah.
About why it is that's not helpful for them or others.
Creations by Beck. I'm going through a really rough time. I don't see a way out. How can I break it? Thank you so much for the support, guys. Yes. We are so grateful, and thank you so much. Every time someone shares, you make another person feel less alone.
Yes.
So every time you share something vulnerable, someone else sees it and goes, hey, I'm going through a really hard time and I'm not alone. We can't give personalized medical advice.
But look, what I can talk about is the more we understand the brain, the more we understand our nervous system. Literally, I was just doing a workshop the other day where we were talking about how there's certain levels of arousal within the autonomic nervous system, and one of them actually makes you feel like it's never going to end, that everything is hopeless and that there's nothing going to improve.
This is forever. I'm going to be
dorsal
miserable forever.
If you're in a really heavy dorsal parasympathetic kind of tone,
explain dorsal parasympathetic.
So I'll talk a little bit more about the autonomic nervous system. I'm just giving it a label because that actually helps, because what you can do is, I feel like this right now, but maybe it's just my parasympathetic nervous system, because that can let you shift back, bring it into an observer position.
It's really hard, Beck.
Yeah. And one of the other things we talk about when people are finding themselves in those states is, have you been in it before? Can you recall a time you've been in it before? Did it end? And sometimes just bringing in that awareness, but the whole time being really compassionate for yourself in, acknowledging how uncomfortable and how real it feels in the moment. It's not about trying to shame your system feeling like that, but it is also about reframing and bringing in a different way.
And this goes for everyone and for everything that, people are dealing with. No, just don't shame yourself. I've never been this low before. So this is a new one. It's going to be hard.
Yeah.
it's going to be brutal. Rest and don't feel shameful for resting. Don't feel shameful
and
for feeling low.
Reach out for help. I hope you've got somebody,
GP first.
We talk about this GP first. It's a lot of them are working with a lot of mental health, and they'll know what's around and what's available. But you don't have to do it alone. That's the other really key thing. Even the crisis lines, they have got really well-trained, beautiful people who simply by sitting with a person when they feel like that can really help you feel less alone with it.
I just want to talk to this because, Kate, I feel ugly and worry no one will ever love me. 1, ugliness is on the inside, not the outside. You don't know what someone looks like until you've seen who they are on the inside.
Absolutely.
And if you're feeling insecure, I just want you to go and take a few really good steps into nature.
And thank you for the comments coming in.
We're so grateful.
We love about this community.
Yes.
Is when others step in. We know that a lot of people out there have had similar experiences. If you've been in that place and you can share with another person just to really
Tara
help them.
said something interesting. We'll come back to you, Tara. Kate, you are beautiful, and if love is something you are looking for and you want, do it intentionally, but reconnect with who you are, things you love, internal things, because it is about who you are on the inside, not the outside. That sounds like a greeting card, but it's so true.
Yeah.
People can, and I can't tell if someone's attractive or not until I've seen who they are on the inside.
But look, let's validate as well. There are, it's a very real experience where regardless of what others are saying, it might be very hard to believe or have that felt experience. And, when your system's connected very strongly to feeling ugly or feeling anything else negative, it can take a bit of work. You don't want to get into that battle in your head where one part of you is just telling you that you're stupid for feeling that. It's actually, that just spirals down. So, if that's what you're feeling right now, part of the first thing is to absolutely validate that that's the feeling.
Yeah.
And then stepping into that observer position, bringing in, maybe it's possible that there's some reason why my brain's, creating that feeling at the moment. I wonder why. My brain's doing that right now. So you bring in that interested, a curious awareness to your internal experience.
And I think this is an interesting jump to the question from Tara, how to get past the judgment from not being believed, especially being conventionally pretty, because many women are not diagnosed because they mask so well, and especially if you present a certain way, they go, you're fine, you're not autistic, you're not ADHD, even though you are.
And look, we've talked about it, if you get your hair done, if you wear
Millennial
makeup and enjoy
around.
makeup, people will kind of go, well, that's not an autistic thing. Well, says who? Says who? It's actually the opposite way. And for autistic women, it can really become a special interest and something they can put a lot of thought and get a lot of pleasure out of.
For me, skincare and makeup, special interest. Again, why I was so late to be diagnosed. Because people think she's normal. No, absolutely not. My doctor said my anti-anxiety meds are safe while pregnant. I'm still concerned.
Yeah, look, I can absolutely talk to this one. It is such a complicated area of medicine, in that we've got ethical issues. We can't do trials in pregnant women. So we can't gather the evidence because that would be unethical. So the only way that we can work with gathering information is by very, very close monitoring of any adverse effects where people do stay on medication. Then when we're sitting with someone who's pregnant or planning to get pregnant and they're on psychiatric medications, we're balancing two things. One of which is we do have very clear evidence that uncontrolled anxiety and depression during pregnancy does have a physical effect. Via higher cortisol, it does affect the development and weights. And so we're kind of left with how do we balance the risk and the benefit, and it's a very individual case. We will do it case by case. I always look, if I'm working with someone, I will look at that time of what's the latest evidence. Is there anything new coming through? Are there any signals we're concerned about? And a lot of us will work with perinatal psychiatrists who do nothing but take that very, very important.
Welcome to the gang, Heavenly.
And work both to kind of get the best balance.
Thank you so much for the support, everyone. Please like and share. We love it. Thank you.
But also hopefully help and explain the rationale behind when do we suggest people stay on medication during pregnancy and why.
I was on medication while I was pregnant. My OB was great. My psychiatrist was great. It still gave me anxiety.
Absolutely.
But,
absolutely.
and
that's part of our maternal stuff coming in.
Exactly.
And that's where anxiety is a helpful, it makes us think about it. It makes us check it out. We don't want people just kind of, it's fine to take meds during pregnancy.
The money to get a diagnosis is very hard,
but continue. We also want to make sure people are informed of all of the risk both of being on and of being off.
Because it's a balancing act.
Yes, a huge one.
We don't want to have a mother who's pregnant whose cortisol levels are up like this. Not good for the baby. You don't want to be taking a million different medications while you're pregnant. Obviously not. It's a balancing act, and your OB and GP and psychiatrist should hopefully be able to talk you through this so that you can really get it. Are you mother and daughter? You're really nice people. Thank you so much, Kate. We have been asked this before, and no, we are not.
Hannah's actually the daughter of one of my absolute best friends. I've known Hannah since she was a baby. So, but yes.
So yes, and thank you. We do have a lot in common, but I do realize that because we both got like dark hair and wear red lipstick, like it kind of translates.
People often think me and your mum are sisters as well. We get it in the markets
because you've got both the curly hair. You look
and
very
we've hung
similar.
Around together for the last 20-something years. So I think it's
yes. And we're side by side.
Thank you very much for Free Your Mind for sharing that, because when people are thinking, oh, look, medication in pregnancy is bad and stuff like that, you need to look at the other side and the effect of depression during pregnancy and then the higher risk of immediate depression post-pregnancy.
You need to balance it. It's going to be different for every mother, and this is not a space where we judge parents and the choices that they make for their children. This is a space where we support each other and validate and hopefully create a community where everyone can do that. If you have severe anxiety and don't take medication, that's your choice.
Yes.
And you would never take it, that's your choice. That's your right. That's your autonomy.
It's actually one of the issues we come up. There's actually a very good...
but we won't shame other people for choosing to take medication.
A very good book written about this particular experience, and I think it's called 10 Reasons to Live by Matt. Oh, gosh. I will look it up in a sec. But it's his written experience of such severe anxiety that he was too anxious to be able to take the medication.
Yeah,
and
I've had that
happen where...
I've had that. That's so crazy.
Yeah, and it's real, and it's I'll just look it up because it's just such a helpful resource.
If you say 10 Reasons to Live, they'll be able to find it.
Is.
Miss Invisible, I was 19 when I had my first boy and went through severe depression and lost my son to my mother, as in your mother took, she became the primary carer of your son?
Matt Haig.
There
we go.
Haig, 10 Reasons to Live.
10 Reasons to Stay Alive. There we go. Incredible kind of self...
Miss Invisible, thank you for sharing. Many women do lose custody of their children when they're going through things like that. I hope you don't feel ashamed of it, and I hope that you're rebuilding all of these relationships and being really proud of yourself. Hi, Zizi.
And look, let's just really talk about, it is a very complicated area from the point of view of choices about medication.
Yeah.
And
body dysphoria, we'll talk about that.
We do have approaches that are non-medication. We do have approaches that are medication. It's very, very individual as to what.
Please don't judge
needs.
yourself, Miss Invisible.
There are definitely, for some people, where the biology has just gotten to a point where it is going to be impossible for them to use psychological tools until they have the medications being able to do some resetting of the brain biology. There are some people who have got genetics that mean that it's going to be an incredible struggle for them to do without medication. I always try.
And that's just the way it is.
And that's just the way it is. For some people, absolutely, they can manage without it. And it's such it's one of the beautiful complexities. And another one of those examples where you just never know what works for you might not work for another person. And when we compare ourselves to other people, we are really going to get ourselves into strife.
Okay, so we're going to talk about body dysmorphia quickly. Heavenly, then we will get to multi-passions. Dom, do you want to explain what body dysmorphia is?
Okay. So that's where people have got a very intense distress associated with a part of their body or their whole body.
And then Carmen.
And so it might be that when they look at their face in the mirror, they can see it's very confusing for people who haven't talked a lot to people who have dysmorphia.
Ashley, I'll write that down.
Because they will often say, look, I can look in the mirror, I can see the face that other people are seeing, but I get this intense distress associated, and for me it feels just awful. Some people will get a real dysmorphia about being in their bodies in general, and sometimes that is a specific condition, the body dysmorphia. Sometimes, have we frozen?
Oh no, have we frozen for a second, guys?
Why does it always froze on horrible
Oh no,
faces?
we're back.
Yeah. Sometimes body, you can have that real distress being in your body if you've got hyperarousal or where your interoception to uncomfortable sensations is very high as well. So it's one that's worth unpacking a bit.
Heavenly wanted to talk about multi-passions when you've got a 9-to-5 job. Schedule the time. Schedule 15-minute blocks where you can explore multi-passions, especially if you're neurodivergent. I set alarms and then I just do little deep dives on whatever it is.
Yeah, it's always bringing in that, how does it work for my brain? What is the thing that you most need? Some people will need to take the time and really deep dive and alternate between them. I will often have 3 going at once on the table.
I will never.
But that is not something that a lot of people's brains can cope with at
Dom and
all.
I are both autistic, but completely different.
So different on so many of the different.
Completely different.
It's absolutely awesome when we
It's hilarious when we compare. We're like, you do that? You do that? Like when I tried to put ice on Dom's face because I love it so much. I'm like, oh, how soothing is this? I'm like, do you want to try it?
Just there, what kind of get this off?
I pushed it on her face and she was like, get it off me.
I've got to get this thing away.
I'm sorry, guys. I'm derailing. So, okay. Carmen, how would I know if I have borderline personality disorder? We can't give personal medical advice. Dom, what's borderline personality disorder?
Okay, it's a very pervasive experience that affects sense of self and has a big part with issues with emotional regulation and capacity to kind of hold the same ideas about people in particular relationships. So a way of describing that is somebody might feel like they're absolutely the best friend and the next moment they feel like an enemy. There's really big shifts in those interpersonal relationships. But there's a lot of self-diagnosis going on out there at the moment. One of the biggest ones I will talk about on that, we've talked about it before, is humans have personality traits. All of us have coping mechanisms. Some of them will be obsessional, some of them will be dysregulated. When we're talking about personality disorder, we're talking about a next level up where it really is affecting functioning in multiple domains, work, family, across the board.
So across any personality disorder, it has to be the core is that it's affecting the functionality of the person. I really just want to get to this because this is our life.
Yes.
Do you speak about ADHD in children? My 10-year-old has recently been diagnosed, but I'm not sure about meds. We speak a lot about neurodiversity in children because we both have neurodiverse children.
So I am not a child and adolescent psychiatrist. My clinical work is purely with adults. But partially what that means is I see the effects, and we are seeing a lot of adults come through at the moment who did not get medication as children, and they feel very, very strongly about what they would have preferred.
They would have preferred to have medication. Yeah.
It's a very controversial area. It is a big thing, to make that choice and make that decision. It's really important.
It is scary.
Absolutely scary. And again, you want it to be scary. We don't want to just be normal.
Because it's serious.
It's all fine.
It's all casual. But it's not casual. It's
of all of the conditions that are out there, ADHD has got such good evidence for the effectiveness of the medication, very good evidence for the secondary mental health issues people are not, and social issues. So if a kid's ADHD is not well managed, they're not going to be able to learn. So then they're getting behind. They're not going to be able to develop healthy social skills. They're
and also
fundamental. The sleep side of things. So people often kind of think, how do stimulants help sleep? If a person's attention is managed during the day, they actually then sleep a lot better in the evening. There's just some interesting stuff coming out.
And sleep is so important for them to retain what they've learned during the day.
Yeah, and it's very, very early. It's just kind of little suggestions at the moment in the evidence. But it's possible that having kids on ADHD medication might actually help their brain develop in some of the areas. And that makes a lot of sense because if a kid's really struggling, if they're constantly in a hyper-aroused state, their brain is not going to be particularly plastic.
And the other thing is that it's very difficult to work out what will the right medication be for my child.
Yeah.
Lots of things, lots of parents have to test medications.
Yes.
It can take months or years to work out the right dosage, the right timing. It's really hard, and it's okay to say this is really hard.
Yeah, but it's also not every person with a diagnosis or every kid with a diagnosis of ADHD needs meds as well. So it's really important to be working with a clinician that you feel comfortable with, that you trust, that you really feel you can talk to, and that they explain their thoughts about it.
Naturopaths, no, I do not.
I'm much more relaxed on that one.
Yeah.
I think there's an awful lot that we don't know about nutrition and mental health at this point in time. The issues that we do find in those areas, first, like
Melissa, I can't believe Purple got banned.
What?
I'll add you as a mod.
Oh. So just on natural medications.
Sea lies will do next.
St. John's wort is, one of the best ones that we know about. It is a herb.
Oh, yeah.
It is a very active SSRI. It is, it's milder than most of the ones that we are using from a pharmacological perspective, but it is
Melissa,
very active.
I've been banned so many times. I'm on account like 5.
To the point that, so with the St. John's wort, we actually have to make sure that people aren't combining it. So if we're starting a person on an SRI, we have to check in, you're not taking St. John's wort, are you? Because they are actually a very active medication. The issue about the natural medications that is that they're not regulated, so their potency is a bit variable.
So Dom has a lot more of a flexible attitude towards this. I'm a bit more like black and white, like show me peer review studies, show me this, show me that. Whereas Dom's like natural healer. Let's do it all. Which again is like so funny that I'm so black and white.
I'll just bring in for Hannah that it's a real issue. One of the problems with the natural remedies is that it costs, oh my goodness, what was the figure I heard recently? I think it was $500 million to take a medication from the lab to a pharmacy. And, that is the kind of sums that only big pharmaceutical companies can be spending when they don't know that they're going to get any money back. And if a natural herb can't be patented, so nobody's going to pay that kind of money for a drug that they can't make any money back on. So this is a real issue within our system at the moment, is funding related to drug trials.
Gracie, if you're in Queensland or Victoria or maybe WA, you can go to your GP for a diagnosis. Can we look at Sea Lies? Because Sea Lies is talking about having those sort of thoughts. Yeah. And we have a few things that we say to anyone
who's having those thoughts.
You
go, Hannah.
You go. Firstly, your feelings are temporary. They're not forever.
Absolutely.
You do not make a permanent decision for something that is temporary.
And they are a signal that you are in distress, and really kind of bring it back to what is causing the distress. And but also absolutely seek help if those thoughts are getting stronger. Reach out, talk to somebody, talk to crisis lines, talk to a GP, talk to friends. From the point of view of schools, oh my goodness, schools and neurodivergence, schools in general, I don't know what is going on out there at the moment. I didn't find school easy, but it wasn't.
It's rough.
Yeah. And it seems to be particularly rough, the academic expectations.
Sorry, I'm stimming on camera.
Sorry. And look, that actually brings up one of the things that might be really helpful to just, and we do bring this back, is there's a lot going on in the world right now. There are a lot of systems that are not working particularly well. And it is really, really important when you are feeling depressed, when you are feeling anxious, when you are feeling hopeless, to check, is it you or is it the world?
Because look around.
And, that if we identify and take it in, we're trying to solve something individually that actually belongs outside. And sometimes we're getting depressed about things that we actually need to be angry about the system about.
And I also see that you've said, I don't have anyone that cares about me. That's probably not true. If you're feeling so low that you're thinking about making these permanent decisions, there are people that care about you, but right now your brain is telling you no one cares about me. But that's not true. Write down a list.
Yes.
Write down a list of all of the people in your life. Write down a list of all of the GPs in your area. Write down a list of all of the things that make you feel good. Putting your feet in the grass, going for a walk, going to the local dog park and petting a dog.
That one works beautifully.
Pet a dog. Go and pet a dog.
Dogs are such great teachers because
oh God, I love
they're
them.
just so open and direct, and they do care. They don't need to have known you for very long or anything. That you can see that love just radiating out of them.
So please trust me when your brain says no one cares about me. That's not true.
Yes,
that is depression talking. People care about you, and in times of depress. Sorry, I'm trying to keep up. DBT kills the TIP. I can't keep up with that. Or in times of distress, DBT kills like TIPP work great as well.
It might be the skills. DBT's got some absolutely awesome skills for working with those kind of thoughts and that kind of ideation. And really, and that's part of the things. If you've got a really intense emotional experience, how do you step back and see it for being an emotional experience, being it temporarily? But also, a lot of us just haven't been taught the skills. DBT does an absolutely great job of teaching exactly. Thank you for recommending that.
And no one at school wants to be my friend. I feel embarrassed. So many people go through that. And guess what? School doesn't go forever, honey.
No.
You're going to finish school and you're going to find your tribe. Now.
And if we're talking about neurodivergence as being part of the picture, I don't know that but just more talking it in, is that, school can be really challenging for neurodivergent kids. One of the wonderful things that we are seeing happen at the moment is, as there's more openness, as more people are talking about their neurotype, is the tribes that are forming.
Yep.
And sometimes, look, it's find them online to start off with. If there's no one in your school who...
the neurodiverse people gather together. We find one another and we're like, autistic?
Yeah.
Autistic, yeah, we know.
A distress school called TIP. Thank you very much for sharing that, because I suspect one of the other great things is, gosh, a lot of this stuff you can look it up and find somebody able to explain it.
Got anything for me? How can I focus while my ADHD is kicking? Oof. It's a rough one.
Work out what,
We'll do another bit on PMDD.
Are there any modifiable things that you've forgotten about? For me, the big ones. Have I eaten? Have I had enough to drink? Have I been sitting in a airless room for too long? They're all really quick and simple ones that it's worth checking in on. It's then kind of trying to look at where's your motivation point. Why is it that you're trying to make yourself focus, and see if that can bring it back in. Some people find timers really help. So
timers for me?
Yes, yeah, and giving yourself short times, depending on your particular neurotype and your brain, you can be amazed how much you can get done in really short periods of time. We tend to make ourselves sick for too long.
Ashley, I did see that, but I wasn't quite sure what you meant. My biggest thing is there is more children who are on the spectrum than neurotypical. The current estimate is that between 10 to 20% of people are neurodiverse, and between 80 to 90% of people are neurotypical. That's the current best estimate that we have.
One of the things we are seeing that's happening, though, which is beautiful and really, really want to encourage, is where neurotypical people are
cups out.
For a neurodivergent person, stimming is pretty well, it's a pretty, for people who stim, it's an essential. It's not something you choose to do. Without it, it's much, much harder to stay regulated. But it works really well for any human. So what I'm kind of seeing is when neurotypical people are kind of going, hey, that's stimming, you feel comfortable doing that. It seems to actually be really working for you. Can I give it a go, giving it a go? And it might not be as essential for them, but, maybe bringing it back in, that it's okay for humans to use that as a tool to regulate. There's definitely a lot of neurotypical people really questioning some of the social conventions of kind of like, why is it not okay to talk about that?
Oh, Ashley, topic? I was talking more about schools need to be more accommodating.
Absolutely.
That's our goal. We are actively trying to get into schools to run programs to educate about neurodiversity and speak to neurodiverse and neurotypical children about how to navigate around that. Ruby, early signs of narcissistic personality disorder or psychopathy in children. That is a fascinating question.
Okay, so that's different for the two. We do not diagnose personality disorders under the age of 18 because there can be very big shifts. Psychopathy's a slightly different one because it's got a very strong neurobiological underpinning. Psychopaths' brains are different. There's differences in the circuitry, and you will see it. True psychopathy, the three things that we look for, and gosh, my brain is so fuzzy today.
It's the triad.
Bedwetting, fire setting, and
animal
cruelty to
herding.
Animals. And if you've got those three, then people are really wanting to wonder about that child's brain. But look, there is this incredibly famous researcher out there who he started researching the neurobiology, doing scans on people with psychopathy.
Right, I've written you down.
Hopped in the scanner and found out his brain looked exactly like a psychopath. Went to his family and said, "What's going on here, my brain?" And they said, "Yeah, we all knew that." But that he had but the family had worked very, very hard from a very early age to accept that there were these aspects and really try and modify and work with them. And he's actually talked a lot about that experience. So,
Gracie, we might have missed it. Feel free to repost.
Yeah, it having the neurobiology does not, put somebody in a category that they can't actually live, be part of a community in a healthy way.
And Dr. Dom is the most compassionate human being on the planet. She's like, we can rehabilitate everyone. We can make everyone good.
No, I do know that, and this is actually a massive ethical debate. Britain does have, where they're looking at, do we need to contain psychopaths, and how do we work that ethically, and how do we provide treatment, and it's complicated area. Okay,
Ruby, we can't give personal medical advice. That's very troubling to me. Please talk to your parents about that. Any advice for ODD in an 8-year-old boy? We're really struggling and not getting the help we need. Again, can't give personal advice.
So I'll talk. What is ODD? ODD is oppositional defiant disorder.
Oppositional defiance disorder. Yeah,
and it's an interesting one because it's purely behaviourally defined. So it's very much about the behaviours. And there are very effective behavioural management treatments for it. The Triple P parenting program, it was actually developed here in Australia, and it's available free to all Queenslanders. It might be actually available free online. It might be Australia-wide, but I know it's definitely available in Queensland. But it is actually it's really helpful to get a professional involved to support you and to really help with your confidence as well.
How do you approach behaviour being context dependent and making sure it's not environmental factors? Gosh, that's a really complicated question, because if you're dealing with neurodivergence, there's so much that you could be asking there. There's a million situations we could be in. There's a million, all these different neurotypes. So I'm not sure that we could give a good answer to that right now. Michael, okay. Just got diagnosed ADHD. Same, welcome to the club. Why are neurodivergent people so depressing? I just don't fit in.
We're trying to change that.
I don't think I'm depressing.
We are really hopeful for the future. It's been different in the past, and, people felt very isolated, very alone. There was a huge amount of stigma about it. We're working absolutely, let's shift that stigma.
Yes.
Let's really shift, people's experience, both their own self-experience and how people in the community look at it. There's some really great signs coming through for
Love you, Chris.
The kids of today, the kids that are getting early diagnoses and growing up in really neuroaffirming households and getting that neuroaffirming support. They are not depressed and anxious as
I love you when you're not in the mood, Chris. Kick them.
It's not necessarily an innate part of the neurotype.
Yeah, Gracie, I'm sorry I did not see your comment. I'm scanning. But can we do PMDD, when to go on meds?
It's again, the whole when to go on meds question is so individual, and really does need to be talked to a clinician about.
Yeah.
And there's no group-wide kind of things. We are looking much more widely at medical intervention in PMDD, and there's a real growing area within the hormone, working with hormones as well as antidepressants.
Oh, the luteal phase. God, I am a demon in the luteal phase. Can we please talk briefly about the main signs of ADHD? Dom, we are over time, so we might finish up with we're getting so many and we're so grateful for them, but we are going to finish up with, can we please talk briefly about the main signs of AU ADHD? Ashley's saying I wrote it down. Let me have a look, Ash.
So there's actually, it's a lot of interest in this at the moment.
Why label downs? Yep, I've got it.
Okay, because it might actually be a separate phenotype. So at the moment there's a real sense for it's a combination of the two. It is from a kind of symptom domain and function experience, but it might actually be a separate condition to either pure autism or pure ADHD. And a lot of people will, I can definitely talk to this one, it can feel like you've got these both, there's the ADHD part of the brain wanting to go one way and the autistic part of the brain wanting to go exactly the opposite way. Autistic side of things, lots of pattern recognition, a lot more kind of rigidity in thinking, liking things to be ordered. ADHD, novelty, after the next shiny object. So it's a really interesting one. People who are AU ADHD are more likely to be, look, it sounds awful, but I think it actually captures it. And I know I kind of feel, hey, that, I get heard when I talk about this, is a superficial sociability is higher. And I think it really answers the, hey, look, internally I feel very autistic in my social interactions, but when I talk to people, they say, oh, but you don't seem autistic.
I've been told so many times.
Yes.
They're like, I would have never picked you as autistic. I'm like, thank you.
Yes.
I'm so glad you love the personality that I designed exactly to please you. So glad that mask worked. That camouflage was designed just for you. Ash wanted to know why she said she had a Down syndrome son and why he needed to be diagnosed and labelled. Usually this is about unlocking funding and support for children.
Downs is a lot more than a neurotype.
Yes.
So just, for general information, Downs is where there's an extra chromosome on one of an extra chromosome. So we normally have 2 chromosomes on each of the different numbers, 13. And Downs has an extra one. And so it's trisomy 21, I think. But,
trisomy 21. Intellectual disability, I thought, comes with Downs.
It's very variable, the different levels people can experience, but it needs to be identified because there are significant medical issues with it as well. There are often cardiac issues, but look, labelling's a complex one. It really does, it depends whether it's being affected by stigma or shame, because labelling actually helps a person embrace, get to know themselves, get to understand themselves, share the lived experience.
I loved realising I was autistic and had ADHD. It has helped me ditch a lot of shame. That's the way that I approach labels. But labels are stigmatized. They make people feel a certain way because there's so much stigma out there.
Yeah.
And what we are trying to do here is reduce that, get rid of the stigma and
bring in the helpful aspects of the label.
Yeah.
And look, well, we are autistic, so my mind loves a nice category, some way I can make sense of something, a label I can put on it so I know which area to store it in my brain. But that's why, I'm very aware that labels really help for my neurotype from that perspective.
And we'll do quickly, how to make friends as an adult that struggles socially. Firstly, get involved in the NeuroKind community. We're an amazing group of people here. Everyone is lovely and wonderful and kind to each other. I see it in the comments every single week.
Yes.
It just makes me feel so damn happy when I see people supporting each other and hyping each other up. Gracie, I'll try and open your comment now.
The other couple of things I'd just say on making friends as an adult, work out what your social needs actually are. So, we tend to have that social expectation of if I'm socially successful, I would have this number of friends or this number of acquaintances and whatever else. But particularly if with neurodivergence, it's really going to vary what fills your cup. For some people, it might be 2 or 3 very good friends. For others, they are going to want friends in different areas within their special interests. So first thing, work out what you want. And then have a look good honest look at what's affecting. And when I'm saying honest, I'm talking about a mindful, compassionate. Okay, are there things that I'm doing that are causing me to struggle socially, and not seeing them as who you are? There's an awesome book called The Autism Relationships Handbook by a guy called Joe Beal, and he is autistic, and he has just been blunt and beautiful and direct, and it's literally it's a little book. But it's an absolute textbook for anyone who's neurodivergent and kind of going, how do I manage the social stuff?
Is there any correlation between BPD falling for narcs? Because yes.
Yes, there is.
There is. I love the intensity, but they ruin my life. Yes.
I'm just going to catch two because I did see one comment from a parent of a child with ADHD.
Yep.
Where they were talking about how the stimulants are really helping at school, but then their child's coming home
Sorry, guys, I'm
very
stimming
angry
on
and melting down. That is a common experience. So what happens is they're able to focus. So suddenly for the first time, they're able to do a lot more at school. They're a lot more involved in things, but also they're potentially doing quite a bit of masking. So then they come home, that's exactly the time that the stimulant's wearing off. So they've got that time where their brain's kind of got less stimulant on board. They're coming out burnt out and exhausted. And you know, it's just from a general perspective, I think, you know, a lot of us are constantly juggling how do we manage that after school time. There's a lot of talk out there about ADHD kids and homework because you've got, you know, if your child's coming.
I think homework's stupid. Why are we giving kids homework?
At this age, maybe when they're older, but...
when they're older, but why are we giving a 6-year-old homework? Just stop it.
A lot of ADHD kids...
Masking is exhausting. Absolutely. Yes, it is.
A lot of ADHD kids will have to discharge energy as well. So if they've been storing it all up, you know, sometimes they really need to run around and get it all off.
Difference between OCD and schizophrenia in neurodivergent teen boy. Schizophrenia is not a neurotype.
It's a mental health disorder.
Yeah. OCD, though, is leaning into...
OCD it can be a disorder. It can also...
Gracie, I actually didn't. I'll check it again.
Okay.
But do you want to answer one of those? I'll just see if I got... Gracie, I'm so sorry. It's not appearing here. I have no idea why. I'm so sorry. But if you DM Chris, and we will be back next week, and if you try and DM us again, I will just quickly find you and hit follow, just in case you're hiding somewhere, and then we can do a response video so we can get to you.
Okay, and I'm just aware of
time. How's your brain going?
Yeah, that might be it for today.
The brain's done. We are done. G, love yourself. Love yourself. That person has dumped you 3 times. They are garbage. Let the trash take itself out to the door.
And on that note.
Love yourself, honey.
On that note.
Trash out. Okay. Thank you so much, everyone. You've been amazing. I have hit follow, so I've requested to follow you, Gracie. So please send it through. And yes, Chris, we'll talk on WhatsApp.
Absolutely. We really appreciate all your questions. We do go through them afterwards and come back to them the next week if we get a chance.
Yep.
And yeah. And I haven't had a chance to look at it a lot, but I have been seeing some wonderful kind of connection and
I love it. Every time I see people supporting each other in the comments, my heart's like ding, 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 ding. And anybody who's feeling sad today, go pet a dog. Go pet a dog. It make you feel better. I'm telling you, I don't care who you are. Go scruffle a dog.
Absolutely.
All right. Goodbye, guys.
Okay.
We'll see you next week, and we will be answering questions in videos as well. And the pod has been delayed by 2 weeks because of our editor, but the pod will drop.
It's on its way.
And you will love it. Okay. Bye, everyone. And thank you so much. And thank you so much, Chris. Everyone, please go follow
Appreciation
Chris.
for Chris. He's been so active there today and just keeping the safe space.
He runs the show.
Yes.
Okay. Bye, everyone.
See you later.